Kingdon, and I'm the medical director at the Aesthetic Surgery Clinic.
Hello, I'm Barbara Lutz, and I'm working here in this aesthetic surgery clinic as a surgeon.
Right, well, Barbara and I have been working together for some years, and I think we agree on some quite important things, don't we?
Yes, definitely. There is a difference between us and, for example, the big companies which offer plastic surgery or cosmetic surgery procedures. And I think one big difference is we have no coordinators, which are a kind of sales staff. They make most of their money by commissions, and this bears the risk that a patient is talked into an operation which he or she later might regret. We don't have that, they just see us.
I know that you feel very strongly that certain personal qualities like honesty and sincerity I know you feel these to be important when you're talking to patients.
Well, it's in sincere cosmetic surgery, I think it's utmost important to like people. If you don't like people and just see them as easy to make money, then you easily can also talk them into something which might not be the best option for them. So I think, as we talked about it, to be honest to the patient, to tell him this is what you can expect. And even to say then, sorry, no, I rather do not operate on you, if I see or if we see that the patient does not seem to understand we cannot achieve his wishes, but is adamant to have this done, then better say no. Or what do you think?
I agree absolutely with that. Obviously we need to talk about the benefits of the surgery, but also we need to go into the potential complications in some detail, don't we?
And sometimes complications are just too high. If somebody has a high blood pressure, which is not regulated, there's a risk of bleeding, for example, or even a risk with the heart. So then we just cannot do it.
Yeah, I think you have to balance, don't you, the potential benefits against the potential side effects. And that's when you decide. And I think you also feel very strongly that patients need to think it over.
Oh, definitely, yeah. It is kind of, a young woman comes, wants to have a breast enlargement, we try on the implants, we discuss sizes, discuss the operation, and then, oh yes, I want to book now. But I prefer actually, they have to digest a lot of information, and they get information material from us, that they really go home, think it over, read the informations, rather come back again with a few questions which build up in between, and then make a decision and not jump into it.
That's right. I agree with that completely. In fact, we make a point here of patients, where patients do sometimes say, "Oh gosh, yes, I'd like to go ahead. Can I do it next Thursday?" Wendy says, "No. Here's all the information. Give it some thought, and we'll talk about it." So there's that essential cooling off period that I think is very important, because sometimes the issues involved in whether you treat somebody or not can be quite complicated, and so you do need to feel that the patient understands everything, don't you?
Yes. And especially in breast implants, it's not something kind of buying a bag and sell it on eBay. If you start with implants, it's a lifelong commitment. You can say so.
Absolutely.